Hello everyone. My name is Simiran Choudhary and I warmly welcome you all to this special edition of our World No Tobacco Day 2025 session where we bring you a conversation that goes beyond statistics, a dialogue that puts faces and futures to the toll of tobacco continues to take on our health, our families and our societies. This session is titled Breathe Free Unmasking Tobacco's Toll, organized by Voice of Healthcare and supported by MCure, where we will explore the often overlooked realities of tobacco related cancers, early detection, treatment options, and most importantly, prevention. And it's an absolute honor to welcome our guest today, Dr. Niti Raizada, Principal Director of Medical Oncology at Fortis BG Road, Bangalore. She is not just one of India's leading oncologists, but also a powerful advocate for preventive oncology and preventive health awareness. Welcome to our show, Dr. Niti. It's a pleasure to have you here.
Thanks so much, Simran. Thanks for inviting me today.
Thank you so much, ma'am, and thank you for joining. And we are thrilled to take this conversation ahead. So, starting with, in your opinion, is tobacco use more of public health failure or a social behavioral challenge? And why it is important to continue observing World No Tobacco Day even after decades of awareness efforts?
Oh, very pertinent question, Simran. Both things, I must say. It is a public health failure. Absolutely. I mean, so many years of preaching and talking about it, but still we have not been able to put a policy together, to put things in practice. I mean, there has been a lot of talks, a lot of regulations, but sometimes implementation is a challenge even now. And the second thing is, yes, it is a behavioral issue as well. I mean, in spite of right education starting early, in spite of having so many campaigns run, even in the cinema hall, everywhere across public platforms, but still we have a lot of youth who are not just migrating to cigarette, but now newer versions like hookah or e-cigarettes. And all of them still remain a very big challenge. And why should we practice till World No Tobacco Day? Well, we always need to talk about awareness. We still know that millions of people die of this disease, not just because of cancer, but because of pulmonary diseases, because of cardiac diseases, peripheral vascular diseases, even central nervous system issues. And these numbers seem to be compounding. So, talking about World No Tobacco Day and especially about quitting tobacco on this day, changing policy, talking about awareness still has a lot of relevance.
I agree with you, ma'am. Why this awareness sessions are still required because now even if we know there are multiple substitutes of tobacco, people are consuming that in form of e-cigarettes and hookahs and like the flavored hookahs. So I think they are increasing more risk to health. I believe. What are some of the cancers that are uniquely or predominantly caused by tobacco use, and how can early they be detected?
Actually, when you talk about tobacco-linked cancers, they are, I mean, I must say most of the cancers have some or the other link to tobacco, starting from the area where we breathe. So, talking about head and neck cancer, starting about nasal cavity, oral cavity, pharynx, larynx, esophagus, which is the food pipe to the stomach, and then we go to the lung, of course. So lung is one we all know is majorly associated. Head and neck cancer, which is a very important cancer in our country, not just because of smoked tobacco, but also because of chewed tobacco. Because South Asia is the hub of chewed tobacco, and second most common cancer in India is lip and oral cavity cancer. Then voice box, which is larynx, pharynx, where we eat. Then bladder cancer, pancreas cancer, kidney cancer. All these also have some association with tobacco. So, smoking and any other version of tobacco, all are known to cause various types of cancers. And yes, you asked me about early detection. Well, see, if you look at it, there are guidelines of early detection in common cancers. And one of the cancers which we can even self suspect is an oral cavity cancer or lip cancer. Just looking at yourself regularly in front of mirror in a bright light. And if there's an ulcer which is not healing, a painless ulcer in the tongue or a non-healing ulcer in your cheek or your inner side of lip for persisting beyond 2 weeks should bring you to medical attention. Lung cancer also has early detection tools now. So, if you are a chronic smoker with 20 or more years of smoking history, that you have been smoking for a certain length of years and many cigarettes per day, then starting from 50 years of age, we do once a year low dose CT scan of the chest. And this is repeated once a year till 80 years of age. And while we do screening for lung cancer, we also should always practice smoking cessation, or at least advocate, have a discussion with the smoking cessation clinic when the patient comes for the screening test as well.
Thank you so much for sharing that view, ma'am, with us. And yes, it is very important to create awareness and how we can self check ourselves, and if those small symptoms can also help us to reach at right time to our doctors. So, tobacco is a key contributor to esophageal and stomach cancer. How often do you see patients present at an advanced stage, and why?
Actually, again, a very pertinent question, because we talk about lung cancer, we talk also about head and neck cancer, but esophagus and stomach cancer again are very unique to East Asia. When we talk about, of course, South Asia like Indians, and of course East Asia like Japan and China, esophagus and stomach has actually is a very pertinent cancer. There are some hereditary factors also why we have so much of stomach cancer and esophagus cancer, but importantly, this is associated with tobacco and smoking, as you just said. And when you add the component of alcohol, there's a multiplication factor. It's not addition of smoking and alcohol as risk factor, it's multiplication of risk factor. On top of it, often patients have reflux disease, which goes unnoticed. And that reflux disease actually is malignancy, which you may have missed. And the next thing is there's often atrophic gastritis or even chronic H. pylori infection, which people just treat as infection, but it could be malignancy. But why is it diagnosed late? Now, that is a curious question. Importantly, we don't do routine endoscopies. That's one reason. Certain countries like Japan have endoscopy guidelines, but and there are also advocates which say that if you have chronic gastritis, if you have chronic reflux, you should go and do a routine endoscopy, especially starting 50 years of age. But these are hollow structures. Now, esophagus or food pipe is just a tube, and stomach is like a bag of food. So what happens is tumor grows inside, and we don't even find out until there is persistent anemia, which is one unexplained because of chronic blood loss, or it becomes so big that it starts doing obstruction and you have difficulty in eating. And that's when you go to the hospital and they find out advanced cancers.
And that's why regular screenings are necessary in that case to find out on time. So, ma'am, we know that we have nicotine replacement therapies. So, can long term nicotine replacement therapy or e cigarette reduces the cancer risk, or is this a gray area in your view?
It's absolutely a gray area. First thing is it's not nicotine replacement therapy or nicotine replacement. We have to be in the time when there's no nicotine use. So this is one important thing. Nicotine replacement therapy, whether it is gums or it is patches, should always be done with medical supervision. You also always have to take prescription of how you are taking and then how you're reducing it. Otherwise, it becomes another addiction. And when you're talking about e-cigarettes, well, e-cigarettes may avoid nicotine or may even have nicotine, but you remember that the way it is delivered is by polyethylene glycol, and that is vaporized product, and that vapor itself is known to be carcinogenic. So e-cigarettes can never be a replacement for cigarettes. It has its own harm, and we have to understand that as well.
Like we're just talking about e-cigarettes and everything, we due to some social media news and every other thing which comes on there, but it's advised not to believe there until unless you find a right source. There are many information coming out that how e-cigarettes are making it more lung diseases more adverse. It is generating into some other kind of rare lung diseases. Is it true?
Yeah, it is true. See, again, as I said, that the way you vaporize things also can be carcinogen, and that's a proved carcinogen. So it may not cause cancer, but it may cause some pre-malignant condition or other lung conditions as well. So understand that e-cigarettes can have their own harm, and they can actually have their own issues, which you need to understand before replacing your with anything with e-cigarettes.
Thank you for answering that question, ma'am. And in your experience, do tobacco linked cancer responds differently to immunotherapy or precision oncology we have?
Okay, very interesting question, Simran, because I don't think I've answered this question in the past with people. See, if you're talking pertinently to lung cancer, I can say something that we treat lung cancer very uniquely nowadays. It is molecularly guided therapy. And whether you're a smoker or a non-smoker, the expression of molecular markers is very different. So if you're a person of Indian ethnicity, a non-smoker, especially a woman, often you will have EGFR and ALK expression. And these subtypes of lung cancer do very well to treatment. You can just give tablets, and some people will do well for years, and in fact decades, even if they're advanced stage. If you are a smoker, then your tumor mutation burden is technically higher. There are certain other risk factors, other molecular indicators, biomarkers, or mutations which are commonly prevalent in such patients. So TP53 is often associated with smoking. KRAS is often associated with smoking. There are other mutations like GEP, STK11. They are often associated with smoking. TMBs, if it is high, if mutation load is high, then yes, a patient responds better to immunotherapy. But that doesn't mean when you compare with an EGFR and ALK positive lung cancer, they will respond extraordinarily good. But a person who has high TMB, a lung cancer, which is associated with smoking, may respond very well to immunotherapy, but not as good as an EGFR positive or an ALK positive lung cancer. Again, if you're looking at head and neck cancer and if it is associated with tobacco, they again have high tumor load and they respond better to immunotherapy.
I think this is something which all our audience needs to understand, that how differently, because of this research and advancements, we have many other tools to treat cancers differently based on each and every different segment of how they have been formed and different therapies we have. So thank you so much for enlightening us on that. So how effective are the newer treatment modalities like immunotherapy or targeted therapy for advanced head and neck cancer caused by tobacco?
Again, see, actually, if you look at it, Simran, head and neck cancer are very curable subset of cancers, especially if they are diagnosed on time. Often, as I said, related to tobacco. And when you find early lesion, let's see oral cavity, tongue or cheek lesion, resection is all what is required. Sometimes chemoradiation is required. If you look at larynx cancer, if it is related to tobacco, we choose organ conserving procedures. So we don't do any radicals because it's a voice box. If we do surgery of voice box, you may actually lose voice. So just chemoradiation is what is advised. Very early stage, only radiation is advised. And these respond very well. When you use newer drugs, like when you're using EGFR targeted drugs or you are using immunotherapy, especially in head and neck cancer, these are generally in advanced stages. So, yes, there may be an important role of newer drugs, immunotherapy, in fact, even genomic sequencing to find out if there are any targets in advanced stages. But then itself, once it's advanced, the results are poorer as compared to early stage. So, early stage tobacco related cancer can also be curable if they are diagnosed on time, and they don't generally need these newer type of therapies. But advanced stages may need these therapies based on certain indicators and biomarkers.
Like you're telling us about if cancer diagnosed on time at an early stage, so how it can do, work. So can you share a story or a case where quitting tobacco drastically improved a patient's cancer outcome or quality of life when they reached out to you?
Similar, it happens with every single patient. See, there are if you people will normally justify saying, now I already have cancer. Why should I quit smoking? This is the first thing they will ask. And there are two things I need to say about this. One thing is that head and neck cancer, again, as I said, early stage are curable, but it
Yes.
causes field cancerization. The entire mucous membrane will have chronic inflammation. And if you have cancer in one side, you can actually have cancer in the other side. And if you quit tobacco at that point in time, it actually prevents the chronic inflammation and actually developing cancer in the other side. That is first thing. And so that's an important need that you should quit tobacco, either chewed tobacco or smoked tobacco. The second thing is lung cancer. Now, lung cancer may often come with advanced stage. Often patients will have stage 3 or stage 4 disease when they are diagnosed. And why should you quit smoking that time? Again, there is a relevance. Now, if you quit smoking, your quality of lung, because you also have chronic obstructive airway disease, you may have chronic bronchitis, cough when you come for when you're diagnosed with cancer. And when you quit smoking, the quality of lung improves. Your tolerance to treatment becomes better. Your overall nutritional parameters become better. And therefore, your overall results improve because you tolerate treatment so well. So even if you have an advanced disease or an early stage, quitting has a lot of relevance. And this is seen in every patient.
Very rightly said, ma'am. If tobacco or smoking has been quit on time, it will definitely help in the treatment procedure, the nutrition absorbment, and in every other thing which can help them out from this cancer disease. Ma'am, we have talked about every other segment of how we can prevent this, the treatment modalities, and we are doing great work together to create this awareness. And we know doctors are doing their bit more than what they can do to, create awareness to treat their patients. So, how can oncologists in hospitals play a more active role in tobacco prevention beyond treating the disease?
Your question itself has the answer that we don't have to react to a case. I think we all have to lead the path of prevention. And preventive oncology has to be our focus. I mean, we have to talk what can happen. And if you stop, then what are the advantages? So all of us not should not be reacting, but we should be actually preventing or propagating prevention. That is one thing. And second important thing is we all have to be advocates against tobacco industries as well. We have to stand up and say, well, this is something which has destroyed lives, destroyed families, and destroying a society. And all of us have to stand together against it.
Definitely, ma'am. And I think slowly or gradually, government is helping us there because the advertisements which come place before the movie starts. So I think that has created a lot of awareness. I believe. So I think doctors, industry, government, everyone is doing their bit, and slowly and gradually, we will see change in the coming days. As we have come to a close to our session, ma'am, what message would you like to share with viewers, especially youth and caregivers, about the importance of saying no to tobacco?
So, I mean, not a very good thing to say, but I just want to highlight that tobacco use does not make you cool. Actually, it makes you a customer. It makes you a customer, whether it is in the hospital, whether it is in a tobacco store. It actually, and we have to come out of that psychology. And also, we have to remember that we don't have to move from tobacco addiction to another addiction. And we have to kind of understand that this is a behavioral issue which we have to fix. We have to actually hunt the root cause rather than looking the peripheral effects of it.
Very rightly said, ma'am. We don't have to shift our addiction to something other. We just have to get rid of it. And thank you so much for creating that awareness with us and being part of this sessions and this initiative we are aiming at. And let's together make our community, our country tobacco free with this initiative. So thank you so much for sharing your views, insights, and expertise with us. It is very important for us and for our audience as well. Thank you so much, ma'am.